Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I will be discussing in detail about the carotid triangle. So the carotid triangle is actually one of the important triangles in the subdivision of the anterior triangle. In the last class, I have discussed about the submental triangle, muscular triangle, and then the digastric triangle. So today's class, I am going to discuss about the carotid triangle. Now, with respect to the learning objectives of the carotid triangle, now in today's class, we will be actually learning about the boundaries of the carotid triangle, followed by that the list of contents of the carotid triangle, and then about the carotid sheath and the Ansa Cervicalis. Okay. Then the major contents of the carotid triangle, such as your external and internal carotid artery, we will be discussing in short, and then the internal jugular vein, about the internal jugular vein, then the nerves in the carotid triangle, mainly your vagus nerve in detail, and then about the cervical sympathetic chain and certain deep cervical nodes. Okay, so these are our learning objectives for today's class. Now, coming to the boundaries of the carotid triangle. So this is the carotid triangle which you are actually visualizing here. So the boundaries, posteriorly it is formed by the anterior border of sternocleidomastoid. Okay, and then posterior-superiorly it is formed by the posterior belly of the digastric muscle. Antero-inferiorly by the superior belly of the omohyoid muscle. These are the boundaries of the carotid triangle. Okay, so that is the outline of the triangle for you. As I told you, antero-superiorly by the posterior belly of digastric, antero-inferiorly by the superior belly of omohyoid, and posteriorly by the sternomastoid. The roof is mainly formed by the thyrohyoid muscle, and then a little deeper plane you have the constrictors of the pharynx, mainly the middle constrictor and the inferior constrictor. Then a very small part of the hypoglossal muscle, which takes part from the hyoid bone, which is seen posterior to the mylohyoid muscle. So these muscles forms the floor of the triangle. The roof is formed by skin platysma and the investing layer of the deep cervical fascia. Now, coming to the list of the contents of the triangle. So mainly the blood vessels, you see common carotid artery, external carotid artery and internal carotid artery, which are actually the two terminal divisions of the common carotid artery. In the carotid triangle, you can see these 5 branches of the external carotid artery, which we will be seeing in detail. Then about the carotid body and the sinus. So one is actually a baroreceptor or pressure receptor, and other one is the chemoreceptor. Then internal jugular vein. Followed by that, other structures is the nerves, mainly the last 3 cranial nerves, the 10th, 11th and 12th, spinal accessory, hypoglossal and the vagus nerve. Then the cervical sympathetic chain is also seen in the carotid triangle behind the great vessels. Then other structures apart from this, a small part of the parotid gland, the apex of the parotid gland you can see, and deep cervical nodes. Now, first coming to the carotid sheath. It is actually a facial sheath which encloses the common carotid artery, internal carotid artery, and internal jugular vein. External carotid artery actually pierces the carotid sheath and comes out. So it is a facial sheath which is derived from the deep cervical fascia. So this facial sheath extends from the base of the skull. It extends from the base of the skull, and below it will merge with the arch of aorta. From the base of the skull to the arch of aorta, this facial sheath extends. Okay, and as I told you, it encloses your common carotid, internal carotid, and internal jugular vein. Between the artery and the vein, you have the vagus nerve lying in between them and slightly behind these two structures, the vagus nerve. So it pierces the sheath and also gives some branches. The sheath, the carotid sheath, is thick over the artery and thin over the vein. So only then it will allow the expansion of the vein. So it is comparatively thin on top of the vein, the carotid sheath. Extension I told you from the base of skull. So where actually the carotid, internal carotid artery will pass via the carotid canal. So there it attaches to the margins of the carotid canal. Okay, then how actually the sheath is formed? So here you are able to see the common carotid artery which is dividing into the internal, this is the external and the internal carotid artery. Internal carotid. This is your internal jugular vein. So the sheath will extend from base of skull to the arch of aorta. It will merge with the adventitial coat of the arch of the aorta. So a cross section of the neck, you can see both the carotid artery and the internal jugular vein inside a facial sheath, and that is the carotid sheath. The anterior wall of the sheath is actually derived from pretracheal fascia. Okay. So this is actually the pretracheal fascia. It is present in front of the trachea, enclosing the thyroid gland. So this fascia extends and attaches about the hyoid bone. So an extension from this forms the anterior wall of the sheath. Posterior wall of the sheath is mainly formed by the prevertebral layer of deep cervical fascia. So the deep cervical fascia, outermost covering you are saying, is the investing layer which encloses the sternomastoid and the trapezius muscle. Then one more layer is the pretracheal layer. The more deeper one is the prevertebral layer which forms the floor of the posterior triangle. So this prevertebral layer actually contributes for the posterior wall of the carotid sheath. So that is why carotid sheath is a modification of deep cervical fascia. Now, on the posterior wall of the sheath, between the prevertebral fascia and the carotid sheath, you come across the Ansa cervicalis, the sympathetic trunk. Posteriorly it is the sympathetic trunk. Anterior wall, what you see is the Ansa cervicalis in the anterior wall, and cervical sympathetic trunk you can see posteriorly related to the carotid sheath. So when a carotid sheath is asked as a question, you should describe about its definition, from where it is derived, what forms its anterior wall and posterior wall, what is the extent of the sheath, superior and inferior extent, What are the relations in front Ansa Cervicalis and behind the cervical sympathetic chain? The sheath is mainly pierced by, one is external carotid artery. It pierces the sheath and comes out. Tributaries of internal jugular vein. So they come and open into the internal jugular vein after piercing the carotid sheath, like your superior thyroid vein, lingual vein, common facial vein, pharyngeal vein, all those things. Then of course branches of the vagus nerve, okay, also pierce the sheath and come out. So now we will just try to understand the next topic. So here you are able to see the carotid sheath, and behind the carotid sheath the cervical sympathetic chain. Posterior wall of the sheath you can see the cervical sympathetic chain. So a three-dimensional view with the section of the neck and part of the face. You are able to see the great vessels. Anteromedially is the artery, and laterally what you see is the vein inside the facial covering. Okay, and it is dividing into external and internal carotid artery, common carotid. Okay, so behind you have the prevertebral layer of the deep cervical fascia. So next, on the anterior wall of the carotid sheath you see a nerve loop which is called as the Ansa Cervicalis. So this is the Ansa Cervicalis on the anterior wall of the carotid sheath. It is formed by superior root and inferior root. The superior root is formed by the C1 nerve fibers, first cervical nerve fibers. They are actually travelling via the hypoglossal nerve. So the hypoglossal nerve, as they descend, they bring the C1 nerve fibers along with them. Through the superior root, it supplies the superior belly of omohyoid. The inferior root is mainly formed by C2-C3. Inferior root is mainly formed by C2-C3. They mainly supply sternothyroid and sternohyoid. Okay, so they mainly supply the sternothyroid and sternohyoid. So apart from that, C1 fibers via descendants hypoglossi also supply the thyrohyoid muscle and the geniohyoid. Okay, so that is about the Ansa Cervicalis, which is also a frequently asked short note. So you should write its formation: superior root and inferior root. Superior root by C1 fibers, which actually travels via the hypoglossal nerve, supplies the superior belly of omohyoid. Inferior root is formed by C2-C3 and mainly supplies the sternothyroid and sternohyoid. Descendants hypoglossi also supplies the thyrohyoid and geniohyoid. Next, coming to the other contents of the carotid triangle. So you are able to see the common carotid artery here. The common carotid artery arises from the arch of aorta. It arises from the arch of aorta, the common carotid artery, on the left side. Whereas on the right side, it is from the brachiocephalic trunk, which divides into right common carotid and right subclavian. So here mainly you are seeing the right side. So the right subclavian and the right common carotid from the brachiocephalic trunk. So it extends common carotid artery behind the sternoclavicular joint, especially for the right side. Left side it arises from the manubrium sternum, behind the manubrium sternum. So from the, anyway it ascends through the, again it has to pass through the respective sternoclavicular joint, deep to the sternoclavicular joint. And then it ascends above within the carotid sheath, anterior to the or medial to the internal jugular vein. The vein is actually lateral. At the level of upper border of the thyroid cartilage, the vertebral level corresponds to C3, C4, third or fourth cervical vertebra, which is the upper border of the thyroid cartilage. The common carotid artery divides into external carotid artery and the internal carotid artery. The external carotid artery is actually anterior and medial, whereas the internal carotid artery is posterolateral. Then why, you might wonder, this is given the name internal carotid and why this is given external carotid is because the internal carotid artery supplies the structures inside the skull. It passes inside the skull, so that is why it is called as internal carotid artery. It is named so. Whereas this supplies the structures outside the skull, extracranial structures, face and neck and the scalp, part of the scalp. So that is why it is actually called as the external carotid artery. Now, contents. The external carotid artery, which starts at the upper border of the thyroid cartilage, then ascends the carotid triangle. It is under cover, the common carotid artery is under the cover of sternocleidomastoid for most part. Only in the upper part of the triangle, the carotid triangle, you can see it is not covered by the sternocleidomastoid. Then the external carotid artery passes deep to the posterior belly of digastric, enters the parotid gland, enters the parotid gland and divides into two terminal arteries, superficial temporal and maxillary artery. Superficial temporal and maxillary artery are the two terminal branches of the external carotid artery. The external carotid artery totally gives 8 branches, of which 2 branches are actually the terminal branches. Superficial temporal artery mainly supplies your scalp. Maxillary artery passes through the infratemporal fossa and then goes deeper through the pterygopalatine fossa and gives numerous branches which will supply a very wide area. Okay, so that is in short about the terminal branches. Internal carotid artery passes again deep to the parotid gland. Okay, and then what happens is enters the carotid canal on the base of the skull. Okay, it is deeper to the styloid process, and the styloid process separates the internal carotid artery from the internal jugular vein. Between the internal carotid artery and the internal jugular vein, near the base of the skull, you can see the last 4 cranial nerves intervene. 9th nerve, glossopharyngeal, 10th nerve, vagus nerve, 11th is the accessory nerve or spinal accessory nerve, and the last nerve is the hypoglossal nerve. So here you are able to see the internal carotid artery passing deep. This is the external carotid artery dividing into the maxillary artery and superficial temporal artery. Whereas this passes deep to the styloid process, and behind you can see the external jugular vein, which is actually not shown in this picture. Now, so coming to the other contents, what is carotid sinus? At the termination of the common carotid artery and commencement of the internal carotid artery, you see a structure which is called as the carotid sinus. It is slightly bulged. The wall is thin, somewhat elastic in nature, and it has got a blood rich nerve supply, mainly from the glossopharyngeal nerve, gives a branch to the carotid body, vagus nerve and a sympathetic branch. This carotid sinus is a baroreceptor. So it mainly maintains the intracranial pressure. It maintains the intracranial pressure. Okay. So what happens is, in certain people who have a very hypertensive carotid sinus, they might get episodes of syncope, vasovagal syncope. So they might go for a vertigo or fainting, and immediately what happens is, on turning the head, suddenly they might feel their heartbeat slowing down. Okay, so reduces the heartbeat, mainly the carotid sinus. Okay, so that is the baroreceptor. The carotid sinus is actually a baroreceptor which maintains the intracranial pressure, regulates the intracranial pressure. It's a pressure receptor. Whereas you have one more structure, that is a nerve supply of the carotid sinus, which is supplied mainly by the glossopharyngeal nerve and also a vagus nerve giving a branch, and then the sympathetic trunk. All these supply this carotid sinus. Next structure is the carotid body, which you are able to see. This is actually a chemoreceptor, so which maintains the oxygen tension. This is actually present at the commencement of the internal carotid artery behind the carotid sinus. Okay, it is present behind the carotid sinus, which is called as the carotid body, posterior to the carotid sinus. Acts as a chemoreceptor or oxygen tension in the blood. So what happens is, when this carotid body is stimulated, it produces an increase in heart rate and BP, blood pressure. So that heart beats faster, pumps more blood into the carotid system of arteries. So that is the function of the carotid body. So almost contradictory to the function of the carotid sinus. Now, in very rare cases, this carotid body might get enlarged. Enlargement of the carotid body is called as potato tumor. So the tumor might vary in size. So it might be a smaller one or very large one, different types. It might compress the carotid sinus. It might compress the carotid sinus, and it might produce symptoms of anoxia. Okay. So fall in blood pressure might take place. Vasovagal syncope attacks also might take place. So based on its size and the structure it compresses, it might produce symptoms. It might produce vascular symptoms if it compresses the external or internal carotid artery, or neural symptoms when it is going to compress any nerves. The blood supply is again same, branch from the glossopharyngeal nerve, branch from the vagus nerve and sympathetic trunk. So, coming to the other contents is the external carotid artery. In the carotid triangle, the external carotid artery gives 5 branches. 3 anterior branches are the first branch is the superior thyroid. Then the next one is the lingual artery. Then the next one is the facial artery. So these 3 are actually anterior branches given by the external carotid artery in the carotid triangle. Then it gives one medial branch, that is the ascending pharyngeal artery. Then it gives 2 posterior branches, the occipital artery and the posterior auricular artery. Okay, the occipital artery and the posterior auricular arteries. So mainly facial, lingual, superior thyroid and occipital artery. Medial branch is the ascending pharyngeal artery. The superior thyroid artery is the first branch, as I told you. It actually supplies the thyroid gland, and it is also giving a branch to the larynx as superior laryngeal artery. So it gives glandular branches. It also gives a branch to the larynx called as the superior laryngeal artery. Superior thyroid artery is the first branch. So here I am able to see the superior thyroid artery, also giving superior laryngeal branch to the larynx. That is the first branch, the superior thyroid. Now, coming to the other branches, lingual artery arises opposite the greater cordua of the hyoid bone, and immediately it passes forwards under cover of the posterior belly and the stylohyoid muscle. Then it passes deep to the hypoglossus. First part is before passing to the hypoglossus. Second part passes deep to the hypoglossus. Third part related to the anterior border of the hypoglossus. So it gives branches, mainly arteria profunda linguae or deep lingual artery. It also gives a dorsal lingual artery. Gives some glandular branches, the salivary glands mainly present there. And finally what happens, it supplies the tongue, that is the lingual artery. The next artery which you are seeing here is the facial artery. Sometimes both arises as a common trunk called as linguofacial trunk. It immediately enters the digastric triangle related to the submandibular gland and the mandible, makes a sinuous course, and then what happens, it enters the face. Same way lingual artery also has a looping over the greater cord of the hyoid bone to permit movements of the hyoid, like how the facial artery permits movement of the mandible. The facial artery in the neck gives ascending palatine artery. It also gives a branch to the tonsil. The chief artery to the tonsil is from the facial artery, tonsillar artery. Okay. So then it also gives submental artery. So submental artery, then also some branches to the submandibular salivary gland, blood supply. These are the branches of the facial artery in the neck. Then in the face it gives superior labial artery, it gives inferior labial artery, and finally it terminates as the angular artery anastomosing with the dorsal nasal branch of ophthalmic artery. So that we will see in the face class, the course of facial artery in the face. So that is about the superior thyroid, lingual, and then the facial artery. So here you are able to see the looping of the lingual artery for the greater heart of the hyoid bone. First part, second part deep to the hypoglossus muscle. Third part is present immediately deep to the anterior border of the hypoglossus. And finally it supplies via the dorsal lingual and deep lingual arteries. So it gives some branches to the sublingual salivary gland. So that is the facial artery in the face, giving superior labial, inferior labial, some lateral nasal branches, and finally ending as the angular artery. The next branch which you come across is the occipital artery. So the occipital artery passes the lower border of the posterior belly of digastric, passes behind, then deep to the sternomastoid, related to the mastoid notch or groove, deep to the mastoid process, and then enters the scalp. So it is mainly responsible for supplying blood supply to the posterior part of the scalp. It also supplies some muscular branches to the sternocleidomastoid. Ascending pharyngeal artery. The next artery is the ascending pharyngeal artery, the medial branch. So here you are able to see the ascending pharyngeal artery. It arises medially, passes over the lateral wall of the pharynx on top of the inferior and middle constrictors. So it supplies the pharynx through pharyngeal branch. It also supplies tympanic branches, and it also supplies the meninges. Okay, meningeal branch it might give, and supplies the meninges deep inside the skull. So it gives meningeal branches, tympanic branch, apart from supplying the pharynx. That is about the ascending pharyngeal artery. Okay, which is seen medially, not easily seen. You have to retract it. The carotid sheath or both the external and internal carotid artery, and only then you will be able to view. It is situated in a more deeper plane. The ascending pharyngeal artery is at a more deeper plane. So I have seen about the common carotid and the external carotid arteries, and a very short introduction about the internal carotid artery also. Now coming to the jugular vein. Internal jugular vein is situated lateral to the common carotid artery, and as it passes above, it lies posterior to the internal carotid artery. Okay, within the carotid sheath, and it extends from the base of the skull as a continuation of sigmoid sinus and terminates as a brachiocephalic vein after uniting with the subclavian vein. The tributaries it receives in the neck mainly lingual vein, common facial vein, lingual vein, then pharyngeal vein and superior thyroid vein. So these are the veins. So here you will be able to see the internal jugular vein coming out of the jugular foramen. Here it shows a dilatation which is called as the superior bulb of internal jugular vein. The internal jugular vein is actually a continuation of the sigmoid sinus. The sigmoid sinus, an intracranial dural venous sinus inside the skull, exits through the jugular foramen as the internal jugular vein. It shows a dilatation, superior bulb. Here its termination, it shows a dilatation, internal jugular vein, that is the inferior bulb of the internal jugular vein. And it joins with the subclavian vein to form the brachiocephalic vein. The tributaries, as I told you, mainly it receives the facial vein as common facial vein, lingual vein, superior thyroid vein, and also pharyngeal veins. So these veins also pierce the carotid sheath to terminate into the internal jugular vein. Next, coming to the other structures, nerves, spinal part of accessory nerve. So this is your carotid triangle. Now the sternocleidomastoid has been reflected so that you can see. Spinal accessory nerve again emerges to the jugular foramen. It is present between the internal carotid artery and internal jugular vein. It crosses the apex of the carotid triangle. Just only the upper part of the triangle is seen. Then immediately it can be seen in the posterior triangle. Spinal part of accessory nerve, which mainly supplies your sternocleidomastoid and the trapezius muscle. The next nerve is the hypoglossal nerve. You are able to see here, that is the hypoglossal nerve. So that passes through the digastric triangle, just crosses the upper part of the carotid triangle. It passes superficial to the external and internal carotid artery, deep to the posterior belly of digastric and stylohyoid muscle. It is accompanied by a pair of veins which is actually called as the venae comitans. It is called as the venae comitans. The branches given by the hypoglossal nerve, that is the 12th cranial nerve, is descendens hypoglossae, as I told you, which is going to supply or forming the superior root of the Ansa Cervicalis, and also nerve to the thyrohyoid, one of the infrahyoid muscle, that is the thyrohyoid. So branches given by the hypoglossal nerve. So that is the accessory nerve, and here you are able to see the hypoglossal nerve in a more magnified view. So it emerges from the anterior condylar canal, and then it passes between the internal jugular vein and internal carotid artery, the last 4 cranial nerves, especially the accessory, hypoglossal and the vagus. Okay, 10, 11 and 12. So this passes on top of the artery and then passes deep to the mylohyoid on top of the hyoglossus muscle. So it is giving a branch to the thyrohyoid here, and descendants hypoglossae to the superior root. So vagus nerve within the carotid sheath, in between the internal and common carotid artery and the internal jugular vein laterally, in between and slightly behind them, you can see the vagus nerve descending. It is actually a vagabond nerve. So mainly it is parasympathetic. Mainly, not all completely parasympathetic, but it is majority of the fibers parasympathetic. It has a very long course, one of the longest cranial nerve, because it passes through your abdomen, lower part of your abdomen, and mainly responsible for the parasympathetic innervation of your thoracic viscera and 3/4 of the abdominal viscera, except your lowermost part of your GIT and some pelvic organs. It is mainly through the vagus nerve. The vagus nerve mainly gives branches in the neck, that is superior laryngeal nerve, which will divide into external and internal laryngeal nerve. Then cervical cardiac branches, mainly it gives branches to the heart, taking part in the cardiac plexus, superficial and deep cardiac branches, plexus. That is the superior and inferior cervical cardiac branches. Then right side, it also gives recurrent laryngeal nerve. Left side, it arises at a more lower level, that it winds around the arch of aorta, but right side it winds around the right subclavian artery. So here you are able to see the vagus nerve, which has 2 ganglia, superior and inferior ganglia. So branches, pharyngeal branch takes part in the pharyngeal plexus, vagus, cranial part of accessory nerve, sympathetic nerves. These takes part in the pharyngeal plexus, which we will talk about later. Superior laryngeal nerve divides into external laryngeal nerve supplying the cricothyroid muscle. Internal laryngeal nerve is actually sensory to the larynx, upper part of the larynx, whereas cricothyroid is actually supplying the muscle motor. So sensory and motor fibers are also there. Then cardiac branches. Then apart from that, it gives branches to the carotid sinus and carotid body. Okay, so branches to carotid sinus, carotid body, pharyngeal branch, superior laryngeal, then branches to the heart, parasympathetic component to the heart, and right recurrent laryngeal nerve, which is seen in the tracheoesophageal groove. Okay, that is the right recurrent laryngeal nerve. This is winding around the subclavian artery. Left side, it takes at a more lower level, not given in the neck. From the thorax, it comes the left recurrent laryngeal. So the next structure which we are dealing is the cervical sympathetic chain, which is seen behind the carotid sheath. So behind the carotid sheath, you can see the cervical sympathetic chain. The sympathetic chain in the cervical region, it is a long chain, paravertebral in position. So it extends from the cervical, lumbar, the thoracic, and then up to the lumbar region. And then it also goes beyond, only in front of the last piece of the sacrum, it forms the ganglion impar. Okay, so the thoracic part and the lumbar part we have discussed in the respective regions. Now, cervical sympathetic chain is mainly formed by three ganglia, fusion ganglionated chains, superior, middle and inferior cervical ganglia. You can see that. So, they are mainly responsible for the sympathetic innervation of the head, neck, upper limb and also gives branches to the heart. Okay. So, to have a very simple idea, so that is the superior ganglia, this is the middle and the inferior ganglia. Superior one is formed by the fusion of first four cervical nerves, middle is formed by fifth and sixth, seventh and eighth forms the inferior ganglia. Sometimes this fuses with the first thoracic ganglia to form the stellate ganglia. Then preganglionic fibers for the cervical sympathetic chain is not from the cervical spinal nerves. It is from the upper 4 or 5 thoracic nerves, thoracic segments of the spinal nerves. So T1 to T5 mainly gives the preganglionic fibers. Okay. So upper cervical ganglia or superior cervical ganglia gives branches. It gives lateral branches, medial branches and the anterior branches. So from here branches go to the internal carotid artery, plexus around the internal carotid artery. It gives caroticotympanic nerves, deep petrosal nerves inside the head. It also passes plexus around the external carotid artery through which sympathetics to the outside or external part of the skull. What are the structures which are present? Sympathetics mainly to the parotid gland, sympathetic to the submandibular gland, passes through the blood vessels, branches of the external carotid artery. Then apart from that, it also gives branches, postganglionic fibers to C1, C2, C3, C4 through this. They are mainly vasomotor, pseudomotor and pilomotor. Vasomotor is to the blood vessels, pseudomotor is to the sweat glands and pilomotor to the erector pylorem muscle of the skin. But goose flesh you get, it is mainly due to the contraction of this muscle in the skin, that is the pilomotor. Somatic branches. Okay, visceral branches, superior cardiac branch, right side gives to the deep cardiac plexus, left side it gives to the superficial cardiac plexus. But the branches to the heart from the superior ganglion does not convey pain sensations from the heart. From the heart, pain sensations is mainly from the middle and inferior cervical ganglia, apart from supplying sympathetic supply. So middle one mainly to the inferior thyroid artery. Okay. So mainly it supplies branches to the inferior thyroid artery. Okay. Then inferior ganglia along to the vertebral artery. It gives two roots, anterior and posterior root to the vertebral artery, and one actually forms a loop around the subclavian artery called as Ansa subclavia. Apart from that, it gives postganglionic sympathetic fibers to the 7th and 8th cervical nerves and also inferior cardiac branch to the heart. So, to the heart, it is from all the three ganglia, but pain fibers from the heart is only conveyed by the middle and inferior. Okay. So, apart from this, cervical sympathetic ganglia also gives fibers via the brachial plexus, sympathetics to the upper limb is also through the cervical sympathetic chain. So that is about the cervical sympathetic chain, which you are able to see here. Next, finally, about a little bit about the deep cervical lymph nodes. So mainly you are able to see the upper deep cervical nodes and the lower deep cervical nodes. Upper deep cervical nodes are called as the jugulo-digastric nodes. It is present in the triangle interval between your internal jugular vein, common facial vein. So in between these two, you will be able to see the jugulo-digastric nodes. The jugulo-digastric nodes are the principal nodes of the tonsil. They mainly receive fibers, lymphatics from the tonsil and from the posterior part of the trunk. Lower deep cervical nodes are actually called as jugulo-omohyoid nodes. They are actually called as the jugulo-omohyoid nodes, situated near to the inferior belly of the omohyoid and the internal jugular vein. They receive fibers from the upper deep, that is your jugulo-digastric nodes, and also fibers directly from submental, submandibular lymph nodes. Also they bypass these nodes and come here. Jugulo-digastric nodes are called as the principal nodes of the tongue, because all the lymphatics from the tongue ultimately come and drain here. Jugulo-omohyoid nodes are principal nodes of the tongue. Jugulo-digastric nodes are actually the principal nodes of the tonsil. Then it also receives the supraclavicular nodes, okay, and lymphatics also from the upper limb, apical nodes. They are also received by the jugulo-omohyoid nodes. So that is about the deep cervical nodes. So with this, I have completed about the carotid triangle. Thank you very much for your patient listening.